University, and this research was done from Natal with my good friend and colleague that is now the Rony professor, Marc Gelkopf, and with the cooperation of Roxanne Silver, who may know as working, did a lot of studies in 9/11. She's from Irvine, California. I would say to the answer before that I do think that there are two issues that we didn't address, and this is politics and money. I doubt if everything is so smooth as we heard before. It's difficult because there is local politics, and maybe I'll talk about it later on in my time. So basically what I do when I study is I work in the trenches, and when I see something, I'm curious enough to study that. So something is working in Sderot, in the city of Sderot, and in the Otef Aza, the Moshavim and Kibbutzim, the settlement there, the rural urban settlement and the rural areas. We saw vast differences between the way residents Sderot and resident Otef Aza deal with the existential threat, the ongoing slaughter of Qassam missiles and the mortar. And we ask ourselves, why? Why is it so? How come so many people in Sderot come to get help, manifest a lot of symptoms in the cities of Otef Aza, or the settlement in Otef Aza are not? And we began to ask the question. Let me just say a few words about protective community factors. I'm not going to go deep into that. There's a bunch of studies around that. There's social cohesion. There is a sense of community strengths. There is an organized social network and strong social institution, which we heard now. How the wonderful program of the group of Cohen are establishing that. Social support between citizens is an important factor, we know. Ideology and collectivistic values are very important protective factor. Religion is a mixed factor, as you will see in my research here. And some other research have shown that there's differences between intrinsic and extrinsic religion, and cultural resources. Various cultural resources predict the way the community deals with things. And of course, money. Money is a big factor. Money from the socio-economical status to the loss of financial ability is a big factor in community resilience. Now, there are a bunch of individual factors as well. I'm putting that in one shot because I think most of us know about it. Female gender is an issue of, there's more risk factor, immigration, lower education, moderate religiosity, etc., etc. I won't go and specify that because I want to go to the results itself. But those are, and there are some factors that relate to the way people cope. Usually avoidance and passive coping seem to be put people more at risk than active coping and dealing with the thing directly. The question that we ask is, are those factors relevant not only in one-shot deals, but in a chronic long-term trauma exposure like the one that the citizen in the south of Israel experienced? So the goal of the study that we put together was to compare 7 years of intense chronic exposure in the town versus the rural communities. And we wanted to know if there are community-related as well as individual-level risk factors or protective factors under the chronic exposure that they experience. The method that we used, we took 4 communities. We took Sderot, which was the city who's more hit, and we compared it to the controlled city of Ofakim, which is a similar socioeconomic environment. And we took the Otef Aza, the rural settlement, and we compared that to a control group, very similar to Moshav and Kibbutz in Lachish, which has not been exposed. So we had 2 groups that were exposed, Sderot and Otef Aza, and 2 groups that were not exposed. We did a telephone survey, random digit methodology. We had an 81% of response, which is a nice rate of response. And that was done just in July 2007. I'm mentioning that because it was sort of the end of the bombardment and the exposure of the citizen there. From there were some sort of still going on, but it's not as intense as it used to be. The questionnaire that you used, I'm not going to go to the psychometrics of it, is exposure, economical loss, previous trauma, perceived threat, number functioning, PTSD and PTS, the PS, in order to define some pathology, coping scales, all of them are validated measure, optimism, social support. Now, this is really interesting because we started to look at more of a communal sense. We'll look at the sense of belonging, commitment to the community, to what extent people want to stay there, and confidence. Confidence in the government and in the army. And we also looked at health care utilization. Just for those of you who do not know Sderot and Otef Aza in brief, Sderot and Otef Aza is the same type of population in terms of number, but very different groups. The Sderot is more heterogeneous, coming from different places, more sporadic Jews, that is, from North Africa immigrants, or later on in Russia. And the other group, the Otef Aza, more Ashkenazi Jews, middle-class Jews, higher class, coming to this area with strong solidarity and Zionistic ideology. Now, both groups at a high level of exposure. You can see the number there as reported by the Ministry of Defense, Foreign Ministry, sorry. There was 4,246 mortar bombs and Qassam rockets falling in these 7 years. So it's an extremely intense environment to live in. The results, exposure. As you can see, exposure level are very high in both communities. The Sderot 97, almost all the population, as well as Otef Aza, were close to rocket attacks. So they all felt the threat. There are some differences in terms of the two communities. In Sderot, there were more people that were directly hit by a shrapnel missile, 52 to 32. Family member injured, very high number, 72, or relative, 72 in Sderot and about 60% in Otef Aza. There are some differences, but they're not substantial. There are differences, significant differences, in the difference between knowing there's someone that was killed by rockets. In Sderot, twice as many, almost, as in Otef Aza. But by and large, and in terms of economic loss, a lot more in Sderot. Again, twice as much as Sderot than in the Otef Aza. But as you can see, a large exposure level. Well, let's go to the results of psychopathology. On the left side, you see the PTSD level. This is full-blown PTSD with functional impairment. On the right side, you see the just the post-traumatic stress. So what we found out is that about 26% of the citizens of Sderot experience very high level of PTSD, and it's a full-blown PTSD. If we compare it to the similar community that was not directly exposed, this is Ofakim in the purple, we see a 5%, so 5 times much. But the most surprising results was the one after that, and that is Otef Aza, and we see 1.5% of PTSD. This is actually lower.
Rony, 3 minutes.
What's that?
3 minutes.
I'm excited. Don't so serve me, please. I'll do it fast.
Don't take it personally.
No, that's fine. So there is a lot. It's the bewildering question was how come a community that exposed similarly to Sderot was lower than the average level that we see, the prevalence level we see in Israel in general. 1.5 is very, very low, and you can see that down on the other side, same thing. I'll present a few more data. The exposure by distress level, and as you can see, in the rural community, even those who are exposed highly are very different from the city. A lot more psychopathology in the city. Level of functioning, we see very significant difference. Lower level of functioning in the city, particularly those who were highly exposed. And medical visits. In fact, in the medical visits to the GP, we found that the people of Sderot were 15 times more than the people from the rural community, although they have experienced similar, not exactly the same level of exposure. Now, what is the conclusions? First, there is a high exposure rate in both society. While there is a significant level of symptomatology in Sderot, there is a lower level, or actually a high level, of resistance in Otef Aza. And the question that we ask ourselves is why? How come that is? So we look at predictors of PTSD and distress. And as you can see on the left side, see if I run it fast, First of all, the sort of demographic issues. That is familiar. We know that. There's no surprise that those predict vulnerability. There's also the predictors of exposure. We know that the high exposure predicts more vulnerability. That's fine. The interesting thing is economical loss and pessimism. This is relatively new, although we know about it, but it's a strong predictor of vulnerability, and this is completely new to me, at least. The lack of commitment to community. Those people who felt, I don't care about my neighbors, I'm not interested in being here, or the lack of crisis social support. This is some of the things that the Cohen Center are doing, the crisis support teams, and lack of confidence in the government. I don't believe my government, I don't think they protect me, etc. And a bunch of predictors that relates to coping. I can summarize it by saying that denial and behavioral engagement doesn't work well, but also venting and also religion doesn't work, at least in Aristotle, it predicts vulnerability. As well as acceptance. Acceptance means I accept the situation, but I don't do anything about it. So it's more of a passive coping. Let's move fast into what makes people vulnerable. We're talking about immigrants, economic loss, those who experience economic loss, lower level of education. Twice, I don't know why it came twice. This is Marc who did it. Maybe you want to stress it. Less community commitment, feeling people that don't feel belong. Those are all factors that relates to vulnerability. Interestingly enough, Orthodox religion and religious people were also more vulnerable. Usually you don't find that, but here we found that. And less active coping and more of acceptance, which is more passive coping. Now, what should we do? First, and this is very important, we need to enhance community solidarity and belonging by creating networking, local leadership, and community involvement. Ideological identification of national values. We need to do something about that. The people who are stuck in areas that they feel the government is not supporting them, they don't know what they stay at, will not be so resilient to deal with the situation. Authorities should be more accessible, transparent, and explain the rationale for the policies, and being closer to the people. We felt that they were far away, and people felt sort of alienated from them. And prevention should focus on vulnerable groups, particularly marginalized, disadvantaged groups, those who lack resources, economical resources, or social support, like immigrants. We need to train GP to identify PT symptomatology, because many people look for that as a first resource. And we need to foster active and positive coping. This is more of the psychological level rather than passivity and denial. The take-home. There are important distinctions in the way that traumatic stress affects the mental health in different communities. We've seen it. Prevention or intervention should focus on strengthening community and solidarity, social identification, belonging, communal health, and leaders and authorities should develop trustworthiness. And the final conclusion, support is provided to low socioeconomic and high-risk groups, which we find that in Sderot, I can tell you personally, has not been well served. Thank you very much.
Thank you.